get that. And I just wanted to thank you all again for your patience and your attention and whatnot. So we're now to the best practices to our employer panel. We just handed out a Y folder where you're going to find great information about what the Fall River Y has to offer. I'm proud to say that I am a Y member. I work out actually in Bedford, but I was able to, I'm allowed to actually use this facility as well, along with all the other South Coast Ys, and that's part of my membership perk, which I think is really valuable, depending on where your employees live and whatnot. So definitely use that information in the folder. It's very informative, and if you have questions, you know you can reach out to myself or Michelle or Emily for that matter. We have Nicole from Kushnick Company, and next to Nicole we have Chris from South Coast Health, and then we have Stu Plotman from Family Service Association. So we're going to go ahead and start with Nicole. And she's going to talk a little bit about how she gets her employees engaged. Because she's got all the good stuff at her
website. Honestly, you know, at a Kushnick Company, I work in human resources, so bear with me and be very nice on the survey because I'm not in the wellness team. But in human resources, I actually have to promote the wellness program and encourage our associates during orientation as well as benefits orientation to utilize the wellness program. We have, our facility kind of sells itself, and I hate to say that, but it's a huge selling feature. We have a lot of vendors on site. Jessica Webb is actually one of ours. She's wonderful. She's one of the vendors that comes in. We have classes on site. We have a studio where they conduct different classes, whether it be from a weight class to a meditation class. We have a gym that has the cardio equipment as well as Nautilus equipment. We are in or right near South Coast, which has the bike path access. We encourage people to join the program so they can get discounts on their benefits as well. So that's a big selling feature for us when we do talk about benefit cost, how much it would cost an individual who's not part of the wellness program versus someone that is part of the wellness program. And that encourages also tobacco-free and well-being. So we definitely have that piece of it. Sadly, it sells itself. You put the money into it, you get the money back. Go ahead, Chris.
Wow, that's pretty. So South Coast Health, we've had a just celebrated. I've been there for 10 years. I just so if anyone wants to contribute to my celebratory trip and to my 10-year anniversary there. So we actually started an employee wellness program, really grassroots, and there was a lot of plugging going on. I was out there a lot, probably more than what the employees wanted, but I kept at it. We built it very slowly. We've been offering health risk assessments, or health assessments as they're now referred to. We were doing biometric screening. We were doing some on-site programming, Zumba, meditation, yoga. A lot of these things we've added in the past few years. We did have some walking programs for our employees. We have a wellness portal. We are with a different vendor. We just recently switched in the year to another one so that we're really trying to touch more on the engagement piece a little bit. And it's a little softer approach and making it a little bit more fun. So we offered smoking cessation classes as well. We stripped down some of the financial barriers that sort of keep people from quitting. We've tied a lot of things, a lot of the incentives in with our health benefits as well. Our wellness program, though, is for all employees, regardless of whether they're on the plan or not. So we wanted it to encompass, all of employees at South Coast so that it would touch everybody. Certainly, there's challenges to having different locations. We're constantly sort of acquiring new places, new physician groups, so it's getting the word out. And I have to say, it's really about being consistent in our messaging. And that could be challenging at times, but we keep pushing it out. So every year we try to get better engagement with our employees and offer some new things. And this year we added some Max devices. We've had mixed signals on those, but I think for the most part employees really appreciate those. They're Max. Anyone have a Fitbit or? Yeah. So this is a fancy pedometer that we have allowed our employees to get. Any employee that's benefit eligible gets one for free. So that's been a nice little add-on. And we've expanded that program as well to family members to a certain extent. So we have a lot of work to do still.
Don't we all? So thank you so much for having me. I'm Sue Popkin. I am from Family Service Association. We are a bit smaller than I think the other two people that are here. We're a nonprofit agency. We have about 325 employees. We are spread out through southeastern Massachusetts, 16 different locations and about 17 different cost centers. So we offer a lot of different programs and services. Our employees can be anything from high school students to physicians and prescribers, and then everything in between. So we're always challenged with the wellness program to find something that will appeal to the different interests of the different ages of folks and to the work schedules that they have. So that's really been one of our biggest challenges. We try every year to be sure that we balance our wellness programs between activities for engagement, awareness activities so folks can learn some things, and then policy and environment change. So we really try for that balance. We deliver our services with a wellness team. So I chair the team, but I don't do everything. I did once, I've learned. The older you get, the wiser you get. So I don't try to do it all anymore. But we bring the team together and we look at who's got an interest in different areas, whose work schedule allows time for something now versus who can do something later on, and then we kind of divvy up the responsibilities that way. We try to find things that are something that people can participate in no matter where they are, because only about 25 or 30% of our people are actually in Fall River and working that straight up 8 to 4, 9 to 5 kind of thing. So what we've currently got going on is a walking initiative. We kind of tagged on to the American Heart Association's walking program, and we've invited people to participate in a 12-week challenge. They signed a form that committed to doing 150 minutes of exercise every week. We found that if you make it fun and kitschy a little bit, that draws people, and if you have competition, that draws people as well. So we've got people registered on teams of 8, and then we're going to offer a healthy lunch to the team that has the most miles over the 12 weeks of the program. We also try to tie things to other things that are going on. So we always offer our employees what we call a summer celebration. It's usually done one of the last couple of weeks in June. It's kind of like our company picnic sort of thing. And we knew that this year the theme for that was going to be the 50s and 60s. So as part of the walking initiative, we gave everybody little miniature like Converse All-Star sneakers as kind of like the tag for walking, and we have them up on a board. If you walk into our central location, they're all up on the board with everybody's name on them. Each week that someone does their 150 minutes, they get a little gold star on their sneakers, so the sneakers are starting to fill up. And then we gave everyone bigger versions of the sneakers with holes punched in it, and each week that you do your 150 minutes, you get a ribbon to tie onto the sneaker. The American Heart Association's campaign this year was every tie reminds us why. So every time you tie in the sneakers, you're reminded why you should walk. So we just kind of took that and morphed it into our own kind of thing and giving out ribbons to people, giving out lunch. It's been probably one of the most popular activities we've had in a long time. People are very competitive. I sent out we had an email go out to everybody. We just finished our first 4-week cycle, so we sent out an email to let everybody know which teams were where. And I didn't give them names, I only gave them the names of the teams. And so we've got the Wise Women walking in first place. I cannot tell you how many people have called me, emailed me, or knocked on my door to say, who are the Wise Women walking? What team is that? What side are they from? How come they're walking so much? I'm like, okay, if you talked to me less and you walked more, maybe your team would be at the top next time. But it's been really successful. And then what we're going to do is have everybody bring those large sneakers, and we're going to tie them together to make the decorations for our summer celebration. So we kind of like bring like everything together that way. Some of our things are successful. Some of them are, quite frankly, big fat flops. I maintain that we learn more from the failures than we do from the successes. So that's kind of our wellness program.
And it's a healthy competition, that's what I like to call it, so just keep that in mind. I'm big on policy. A lot of you know I've come to your work sites and talked about how we get healthy vending policies, healthy meetings around what kind of food you're gonna serve, you know, not pizza and soda, and then writing that into a policy, right? And I have that blueprint at my office, and I already have the wheel invented, so you don't have to do it yourself. One of the big achievements that South Coast Health has been able to do is actually go tobacco-free. So I just wanted to ask Chris briefly to talk a little more in depth about maybe some challenges around that and when the policy went into effect. And what are those smokers doing now? Where do your employees go to smoke? Because a lot of you have designated smoking areas, but a lot of you want to go tobacco-free, right? Can I see some hands? Okay, so go ahead, Chris.
Okay, well, I'm not a spy, but I have my suspicions about where they are. So somehow we do sort of know where they are. So if I'm speaking to you directly, you'll know I know. So let me just preface this by telling you that this, for us to go smoke-free wasn't a 2-week ordeal. We actually wrote a policy in 2008. We went smoke-free January 1st, 2012.
Wow.
So, you know, wellness is really about baby steps, right? So we know that we can't make people change or push them to change in a short period of time. So that's really an important piece to sort of remember. So in 2008, we wrote a policy which really, I mean, that's a lot of
That's
where
the
it
easy
starts.
part.
That's the easy part. So what that policy really described, you know, obviously it spoke to our employees, and it was about really cutting down. We recognize the health risks of smoking. We want to encourage a smoke-free campus. We're just going to have designated areas. So we started there with designated areas, and they were huts, and y'all knew where they were. And if anyone went to any of the hospital campuses, you probably could tell. You probably thought at first maybe they were bus stops, but they really weren't. We also put some information on those huts about our smoking cessation programs. So that was sort of the first step, and really I think in healthcare, I mean as healthcare workers, you know, we hope that our employees know the risks of smoking. So we highlighted that, and it was really about focusing on the wellness of our patients and their families as well. So it was you know, bigger picture than just about our employees. So and in the meantime, as we're sort of ramping up to really going smoke-free, one of the things that we did is we planted the seed during that 2008 period where we were creating that, where we created the policy, saying that we knew that we were going smoke-free. So you plant that early, so then you know, okay, it's coming. So we decided to, we certainly branded it. You might have seen the Breathe Better campaign. We wanted a nice soft touch, you know, a little bit less suggestive. You know, if you're a smoker, you're just really a bad person. It was very soft, and if you've seen the signs, it's, you know, pictures of parents with their children, and goldenrod, which really is not really my friend right now. But they're just really soft, a softer touch. We also provided some dialogue so that if our employees, whether it was they saw another employee smoking outside of the restricted area or perhaps a visitor or patient, then they would know how to approach that. So we had certainly a leadership presentation so that the leaders of South Coast would know how to, you know, what to say and what to do. And it's really about the consistent message too. I mentioned that a little while ago. That's key, that everyone's on the same page. So in the meantime, we knew, we had a small group. We partnered with the Human Resource Department and then some support services. So it was a team of people that really got this, you know, this next step of going smoke-free together. So in the meantime, we ramped up the marketing. We had news press releases, you know, emails internally. And then we decided to take it to the next step. We rewrote that policy that we created in 2008, but this one reflected that it was smoke-free. So now we're going to a smoke-free, you know, campus. We let employees know, we let the visitors know that those designated areas were going to be removed. And I'll never forget the day It was December 31st of 2011. And I remember there was a lot of discussion. Do we remove them at 11:59 p.m.? So it was a big deal. And it's about balance too, because you really don't want to anger people, but I think if you include it with the message of this is about your own well-being, your own wellness, then the sell becomes a little bit easier. So those areas were removed completely. It was a cold day. There was no snow. I remember this. Like, I remember a lot of the big events. It's sort of pathetic, but I remember. So those were removed. And in the meantime, we're all ramping up. Probably September of 2011. So this is about 3 years later that we start messaging out press releases. We're going smoke-free. This is how it's going to be at South Coast. So come January 1st, those designated areas are removed. And I can't say that the smoking stopped completely because we know it didn't. And of course, being a healthcare organization in a community-based area, it was important for us to let our employees know that there was no smoking allowed. There was a period of time where there were some employees that were smoking, and of course our neighbors will let us know, so we addressed that, and there were ramifications for those employees as well that were actually caught. Can I say that it went perfectly well and there was no smokers? Absolutely not. It's about educating, it's about the leaders and approaching employees or visitors and patients to let them know that we're smoke-free, and we hope that you will support that. Most of them are pretty good. I've approached quite a few, so I'm alive and well to tell you that it's okay. But I think if you as far as approaching that, it's about well-being, it's about their health. I can't think of any articles that are out there that says, or indicates that smoking is good for you. Anyone aware of any? Because I'm not. Well, maybe from the tobacco companies, but they have something to say. But it's really about that, and it's a constant. In fact, there was an email that just went out to our employees just earlier this week, addressing it again as a reminder. Our neighbors are important, and there's no smoking. So.
If I could actually add to that, we do have a tobacco-free policy, and we have all of our new hire associates sign off that they understand that there is no smoking, there's no tobacco products held on our property at all. Like, you can't get in your car at the end of the day and light up and drive out of the parking lot. You can't do that at all. Physically need to remove yourself from our property in order to have tobacco products. And I have a fun story. I have this gentleman that works with me. He's 87 years old, and he's been smoking since he was 11. So we've tied our tobacco-free to our wellness program and our health benefits. So you can get the discounted rate if you're tobacco-free and you've had an annual physical in the last year, and you get that discounted rate. So this gentleman has been paying the high rate for as long as he's been there, and I want to say he's been there now. This year will be 19 years he's been there. So he ended up going tobacco-free this past year.
Wow.
And and to your point, it was a constant every open enrollment. I sat with him and I'm like, you realize you're paying this because, Nicole, I've been smoking since I'm 11. I'm not going to stop smoking. So I enrolled him this year. He went through the smoking cessation class, and then he just stopped. And so there is those small success stories.
Yeah.
Of course, at 87, I was like, oh God, like, is that going to do something? Like, is it going to have the reverse effect? But I mean, he's still around, he's still great, and he's still tobacco-free. So yeah, we do the same thing for the tobacco-free policy. You do have to have those constant conversations with people, though.
And one thing, oftentimes it's hard to really measure how many smokers we really had. We sort of started at 20%, and I think as time goes on and there seems to be more of a taboo, I think that number is more of a mystery number now. So, I do know we've had a fair amount of employees that have quit successfully. So, again, it's that constant messaging. It's not constantly staring at them and pointing it out.
We went tobacco-free as well, and we did a little similar to what Chris described. We had a little lead-up. We knew that there were certain departments that had more smokers than others, and so we used our human resource department to provide additional supports for the supervisors in those departments, knowing that when the quit day came, so to speak, it was going to be more difficult. We had one department of 7 people, and all 7 staff smoked, and the supervisor was saying, you know, it's easy for so-and-so who has no smokers in their program. This is going to be a nightmare for me. So we provided extra support for that individual. And we used it as an opportunity to also clarify our break and lunch policy. Because we had some folks who said, well, I get an hour for lunch, so I'm going to break that into 6 10-minute blocks so that I can go out and smoke. And that then became a hardship for other workers who are answering their phones and responding to requests because this person is out smoking. So we used it as an opportunity to tie all of those together. And kind of similar to what you said, the maintenance man at one point came up to me and said, I hope you're happy, I haven't smoked for 4 weeks. It's like, Frank, I hope you're happy. I know your wife's happy because I heard from her. And we did, we actually had people say that. They quit because it was just too much of a pain in the neck to smoke at work. And sometimes, as much as we want people to come to wellness because it's what they want, sometimes we just have to make the healthy choice the default choice. And it had good results because people then quit because it was easier than working around trying to sneak in the cigarette.
Can open it up for questions. If anybody has any pressing questions, and it can be all related to, you know, physical activity, policy implementation at your work site, employee engagement. Raise your hand up first.
Hi, I work at BCC, and the college went smoke-free about a year ago, maybe a little over a year ago. But they, because we have students as well, you know, they can say that the environment is smoke-free and you can't smoke on campus, but because it's personal space, they can smoke in their cars or out on Ellsbury Street. And it's kind of caused, it's been great. You know, you don't have to walk through that wonderful cloud of smoke walking into every single building. But the students smoking in their cars is still quite an issue. And so I was wondering if you could suggest anything with as far as policy goes, because we have that public-private sphere that we're kind of in, you know, in the middle of. We can't just say, okay, you just can't smoke. So I was wondering if you had any suggestions of tackling that.
So the way that we've done it is, I mean, their cars, like I said, they can't light up in their car and then drive out of the parking lot. We used it as property. Anything owned by a Kushnick property, you can't be on the property. So that's how we addressed that. You know, I actually did have a situation, a gentleman had a convertible and I was driving behind him in the summer, and the next morning I went over to him and I said, hey, as a reminder, you know, there's no tobacco on the property. I was driving behind you yesterday.
Right.
Unfortunate for you, because it was me. If it was someone else, they wouldn't have said it. But so we addressed it from a property standpoint. I don't know if that might be helpful. I don't know about you.
Yeah, that's how we addressed it too.
Right.
Now, when you say you can't, because I always struggle with that, when you say you, what are the consequences?
Disciplinary action.
So that's, you follow
Verbal,
through.
written, I mean.
Because I say if you don't have consequences, you can't, doesn't, you can't because,
Right.
you know, because why? And I struggle really is with the consequences. You know,
Yeah, it follows through the disciplinary action. You know, we've had individuals at our facilities that try to go behind dumpsters and have a cigarette on third shift. Like, nobody's going to find me there. Well, we have security cameras, so we find you. And it does, I mean, the first step is verbal warning, second step is a written warning, and we go through that disciplinary process.
And that's great with employees, but when you're dealing with patients.
Or students.
Or students, it becomes a little bit more complicated into how do you, visitors, how do South Coast manage that?
We encourage our leadership. I mean, I know I approached a lot of visitors, and it's about feeling comfortable and having that dialogue and knowing what to say, so it's a consistent message. So if employees didn't feel comfortable approaching a patient or a visitor, they could get their managers and they would approach that. Security was really well involved with this. They knew and they know where the smoking areas were, so they were able to identify those and have some conversations with the folks that were out smoking in that area. I think it's just, you know, it's a constant. It's consistently putting it out there. And I think as far as the policy is including it, that just like any other policy, if it's not going to be followed, then there's probably some disciplinary actions for any other policy, and that would be the same.
To that point, we have several consultants. We were recently purchased by a Korean conglomerate, and the new CEO decided to come and visit our headquarters and lit up a cigarette outside the security office. So we had to have that conversation with him. So again, it comes down to encouraging the policy and the communication, definitely from the leadership down. And honestly, we have our security as an outside third party. The security guard went and spoke to him.
Yep.
So they even have the backing of management within the organization to have those conversations.
We took a different approach to it. So our CEO didn't want to cross that line and tell people what they could or couldn't do in their private vehicles. And so we left that vague in the policy. We simply said you cannot smoke on our property. And then we clarified what the lunch and break schedules were. And the plan was that if we had someone who had a 1 hour lunch who went out in their car and smoked their brains out for an hour and then came in and reeked and were offensive, they would be addressed. Just as you would address an employee that didn't bathe or that came in looking hungover or any of that kind of thing. It has not needed to be addressed. We do have people who will go out on their lunch hour. And literally, like out of 325 employees, I think I can think of 2 who will light up and drive out of the parking lot, and there's one that will take their break in their car and have 1 cigarette. But it has not been an issue. I think that being in a school-based setting like you are, your population turns over continually. So I think Simone and Chris both made the point that it's always got to be on the radar. It's got to come up. You've got to constantly be marketing to your stakeholders that this is what we're about.
Yeah. Before we go to this question over here, I just want to remind everyone there's not a one size fits all. Every work site here is different, okay? So just take all of this information in and just kind of digest it slowly. So go ahead.
Hi, I'm Rhonda. I'm the Director of Human Resources at Lifestream. I'm wondering what type of tools and resources that you all offer for smoking cessation. Like the education, the policy, the backing and support from leadership, but what actual, you were talking about a nicotine patch.
Yep, nicotine replacement therapy. So we actually offer different, sort of different levels of smoking cessation because we know that some employees do better on one-on-one counseling versus group counseling. So, or they may want to do telephonic. So that's how we had ours sort of layered. So we had we use a local vendor in Fall River for one-on-one counseling. We had group counseling. We had Fresh Start and then Freedom from Smoking. So those 2 different programs. And then we had, at the time, we were with a vendor who provided some health coaching for smoking cessation. So we teamed it up too with a class. They had to do a class. If they wanted to do nicotine replacement therapy, they had that option as well.
Yeah, and just to bounce off of her, I am a trained tobacco treatment specialist, so I'm able to come to your work site at a low cost and offer a group if it's warranted. You will find most people that do not necessarily want to be in a group setting, but that's an option. And most NRT, you need to check with your health insurance provider for your employees. Most NRT is covered at no cost. They want them to obviously quit the habit. So the NRT is specific to the patch, the gum, the lozenges, and then you have the pharmacotherapy, right? You have the Chantix and the bupropion. So just to specify what that is. I know there's a lot of acronyms out there.
We created a binder of information that we kept in our Human Resource Department with all kinds of resources that people could use for smoking cessation. Everything from providers that do acupuncture to help with smoking cessation, to group classes, individual counseling, so that was available. We purchased the gum and the patches and had that available for folks who wanted it. We had offered smoking cessation classes prior to that. We also will subsidize for anyone that wants to go to a South Coast class. If they bring us their paper that they completed the class, we will then reimburse them for the cost of the class. And then during the first 2 weeks when we went smoke-free, we provided hard candy and lollipops in every department.
Sugar-free, preferably.
They were. I think the hard candies were sugar-free, the lollipops were not. Yeah. And I think they kind of really relaxed around if someone needed to go for a walk just to like decompress a little bit, or if they, you know, needed to take a few minutes break from their work to kind of get over urges and those kinds of things. That was available as well. I would say that, you know, being creative is helpful, and really nothing is impossible. I think building relationships, a lot of people think that it's expensive to have worksite wellness programs. We were very fortunate when we started that we were funded through a Department of Public Health grant that was helping worksites get wellness going, and so we had dollars. I will tell you that when we got into year 4 of that funding, we were funded with $10,000. We were like, how are we going to spend the money? Like you find ways to do things that are really inexpensive, and so it doesn't really need a lot of money. Our walking initiative so far has cost us maybe $125. It'll be the cost of the lunch, and that's all. A lot of it's building relationships with the other work sites, and how did you do that, and where did you go? The Worksite Wellness Collaborative is a great way to get ideas on how to do things. And certainly if you have ideas, just ask, because you'd be surprised what people will in fact do for you. Our CEO, she's just very open and innovative, and one day I go in for supervision with her, and she's got an article that's cut out of the newspaper. And she said, I saw this in the paper, and I was wondering if you could call them and ask them if they would come here and do this. So I look at it, and it's a vascular lab that's offering vascular screenings to the public, and they're going to do sonograms, they're going to do all this elaborate testing. And I said to her, so my background is as a registered nurse, and so I said to her, Carol, that equipment that they use is not like travel ready. It's big. It fills a room. They can't just pick that up and put it in our conference room and do those screenings. They're not going to be able to do that. And she said, oh, okay. If you don't want to call, that's okay. I'll have somebody else call.
Oh.
So I said, no, I'll call. I will call. You're absolutely right. I will call. And I called, and lo and behold, they said, if you can give us a pool of people who meet the eligibility requirements, which you had to be over 40, we will close down our vascular lab for 4 hours, and we will screen just your people. We brought 40 people down. Actually, I think we brought 42. They had thousands of dollars of vascular screening for nothing. It cost nothing. We offered to put out a light. We did it from 4 to 7 p.m. So we put out like a light supper kind of a thing, so people could have a healthy something to eat before they went home. But it was thousands and thousands of dollars of testing. They identified 2 people, one person that they said had to come back in 6 months, that they needed to watch, and then one that they recommended come back in 1 year. So it was a great, great service. And my initial thought was, they're not going to do that for us. So, you know, keep an open mind and really be creative and tap into, we do have a rich community as far as those kinds of things, so take advantage of that.
Something to keep in mind too, you know, we have both West Coast and East Coast, and we have about 1,800 employees in the U.S. And we also have sales that travel that don't all want to be part of wellness. They don't want to go to a class. They don't want to be seen in exercise clothes. It's just, they don't want to be part of that. So we've done the wellness portal where they can go and can watch the wellness videos. We highlight different things. It's not just specific to, you know, getting fit. It's about dietary nutrition. We also talk about financial and EAP programs and other programs that we offer. From a Salesforce standpoint, we'll send out packages to the Salesforce, how to work out at home or how to work out while you're traveling. It's an elastic band. So, you know, the cheap things that you can do to also include the people that don't want to be part of the greater pool. The walking thing is huge. Everybody can walk, and if you can't walk and you have a wheelchair, you can wheel with them, you know. So there's definitely benefits that you can do with that. Competitive nature, everybody has a competitive side. They all do. If you put in a program, they're going to compete against each other. Here's a team there, here's a team there. We're doing a walking challenge right now. Hugely competitive from facility to facility. Like, oh, I heard they're doing this much, and oh no, we're going to beat them. And so getting that healthy competition out there is great as well. We also do a family 5K. So we encourage everybody to come to the industrial park, the entire family. Sign up, come walk on a Saturday morning with us. Walk, run, do whatever you want to do. So it's definitely all-encompassing. You can do individual things. You can do them pretty inexpensive as well. If you're doing a walking challenge, to your point, it's a lunch. How much does a lunch cost? I'm sure that somewhere in someone's budget they can come up with a lunch value. So things along those lines. You can go from one extreme to the other. We have wonderful facilities. but we don't always have to encourage everybody to use those facilities. We encourage them to do other things as well.
Okay, this is great. Just want to remind everybody that I think if you need to contact any of these work sites, if you have further questions, you just reach out to me. I'm happy to connect you with them. I think CEO buy-in is obviously a big key factor with all of this. And if any of you are starting from the ground level, don't get frustrated. We can do surveys. I have surveys available so that, you know, the first step is really to find out what your employees want. And then go from there. So I would like to thank you guys. I really appreciate your time today.